Hi guys! Thank you so much for joining the call. My name is Desiree. We've been in communication via email, and with us is Jessica Henshaw.
Hi.
So I'm the volunteer coordinator, and my team and I work together to make sure that all of the application process, all of the paperwork, and all of the logistics part is ready for when you come down. And then maybe Jessica, you can talk a little bit about your role.
Yeah, so I'm the Global Health Education Coordinator. And so what that means is I'm in charge of the Global Health Practicum, curriculum development, also short-term research projects. So yeah, if you decide to come down to our summer programs, you will be working a lot with me.
All right, so we just wanted to turn on the webcam at the beginning so you guys could see us, but it actually helps our internet connection, which isn't great here in Nicaragua, to have the camera off. So we'll be turning it off.
And we want to tell you too, we're actually in a coffee shop right now, so there's some like background noise. We couldn't connect to our web server in Amos, so we're at a coffee shop. So excuse the background noise.
All right, so I just want to confirm that you can hear us. As you can see, I believe it's on the left side of your screen. There's a chat box. In case you can't see us, please let us know. I know some of you are on the phone, so you can unmute yourself and let us know if you can't hear us. If you can hear us, could someone send a quick chat through the chat box, just confirming that you can hear us? Excellent. Thank you. All right, so we received emails from several people that won't be able to join us today, but we're recording. So thank you so much for taking time out of your schedule to speak with us. All right, so let's go ahead and get started. And just so you know, at the end of our info session, we're going to have some time for Q&A. So as we're talking, please write down your questions so we can answer them at the end. All right.
Okay, so this is Jessica speaking, and I'm going to cover a little bit of the history of Amos and also the context in Nicaragua where we're working. So, excuse me. So, just a little bit of the context of Nicaragua. Nicaragua is the second poorest nation in the Western Hemisphere with a 70% poverty rate. We have the second highest teen pregnancy rate in all of Latin America, behind the Dominican Republic. 45% of our population lives in rural areas, and these areas are really, really geographically dispersed, and they have really low access to healthcare services. For instance, some of our communities are over 6 hours away from their nearest hospital or even health post. Poor children in the rural areas are 3 times more likely to die from preventable diseases like diarrhea, neonatal sepsis, or pneumonia. So just giving you a little context. And so with that context, I kind of want to launch into why we're here and why Amos is here. So Amos, while our organization was founded in 2006, we actually have historical roots of about over 40 years, actually. So the father of Dr. David Parajon and the father-in-law of Dr. Laura Parajon, who you see here in this picture, started an organization called Providenic, and they were really focused on community development. So when Dr. David and Dr. Laura came to Nicaragua, they wanted to continue with this work and also shift it to a healthcare focus. And so Dr. Laura says this quote all the time. So as physicians in Nicaragua, we see ourselves as teachers more than clinicians. And so this is really what Amos is about. We're all about walking alongside communities and empowering them so that they can change the health and the development in their own communities. And so our mission, kind of like I just stated, is to improve the health of impoverished communities by walking alongside them in health, development, and education. So we work in 22 rural communities, which you can kind of see dispersed across the Nicaraguan map there. And we work in one urban community. So you can see the star, and that's where we are in Managua right now. So our overall model is called community-based primary healthcare. And so what this looks like is we are invited into communities by, for instance, the communities will write a letter to our organization expressing interest that they want to work with us. And so we ask them to form a health committee, and they form this health committee, and they also select a community health promoter. So AMIS trains these local leaders to provide healthcare, life-saving healthcare to their communities, which, like I said before, are really far away from a lot of health posts. So if you're familiar with the community health worker model, that's what we utilize here at AMIS. So essentially, we train our community health workers to kind of like almost at a nursing level, actually, so that they can deliver different medications, they can deliver life-saving care and preventative treatments to their populations. And so our community health workers serve what we define as vulnerable populations in their community, which are children under 2 years of age, and then pregnant women, and also anyone with a chronic disease. And so within that community-based primary healthcare model, we have all the other programs that you see here. So we have nutrition, we have clean water and water sanitation and hygiene programming, we have youth empowerment, women's empowerment, essential care for every baby, which is really cost-effective solutions to make sure that we decrease neonatal deaths. And that looks like initiation of breastfeeding, skin-to-skin contact to prevent hypothermia, vitamin K shots. We also, if you remember that star on the map in our urban area, we have a clinic, and we are working on our health promotion in our urban areas. We have some really cool programs going on there. And finally, we just received a grant from USAID to carry out a Zika prevention strategy, which we're calling the Care Group Strategy, for the next 3 years. So now I want to talk about why we want you to come and why we developed this program. So we noticed that sometimes students have a problem with a lack of connection between the theory that you get in your classes and hands-on work. So a lot of times the theoretical study of global health in university courses doesn't lead to much practice. And then sometimes short-term service trips aren't as evidence-based, or just don't give you a really deep sense of how some of the organizations really embed themselves in the community if you're working on a short-term mission basis. So we really wanted to create sustainable programming where students can undertake short-term projects that are embedded and contribute to long-term goals that will ensure just and lasting change. So this kind of leads us to two questions. How do we give students the opportunity to learn and practice public health skills while creating real impact, without exacerbating the very inequalities you wish to address? So this is why we're here, to develop that exact programming. So we do have some opportunities for students, and these all take place in the summer. So that will be from the beginning of June through August. And we'll get into dates later. But we have 3 opportunities for students to come down. We have the Global Health Practicum, the Capstone, and also internships. And I'll start talking about those right now. Actually, Des is going to talk about the Capstone and internships. So I'll just be talking about the Global Health Practicum. And so this is a little graph displaying what the time looks like. So for the Global Health Practicum, students will come down for 3 weeks. For the Capstone, students would be there for a total of 6 weeks. So the Capstone students would participate in the Global Health Practicum, and then they'll stay an additional 3 weeks. And then finally, the interns take the Global Health Practicum, and then they stay for an additional 5 weeks. So they're here for a total of 8 weeks. So now I'm going to start talking about the practicum. So our practicum is 120 hours, or like I said, 3 weeks of global public health and hands-on training. So what that looks like, for our first week, we have a classroom orientation at our urban center in Managua. And so this really immerses students into community-based primary health care. We share our model with you. We talk about our monitoring and evaluation strategies, how we collect data, and how we do community empowerment. We also touch upon really hard-hitting topics too, like cultural humility, which is really important to us. Really critically thinking about institutions and the power that they create, especially with global health funding and things like that. And so for our second week, all the students go into one of our rural field sites, and we'll cover some of the projects that we have in those rural sites. And then finally, in the third week, during the practicum, students come back to the classroom, and we have an even more skills-based week of classes where we're really fine-tuning some different strategies. For instance, this year we're going to be implementing a low literacy level curriculum building workshop into this week. Last year we worked on a project called barrier analysis, which is an evidence-based research methodology, and our interns ended up using that during one of their projects, actually during 2 projects we had. So that week is a really great week as well. And so this is kind of, so our learning modules, you'll see listed here, kind of I covered a second ago, will be community-based participatory research, power and privilege and cultural humility, community empowerment, social determinants of health, political, economic, and social climate in Nicaragua. We'll talk about our WASH programming, and then we'll get into some more kind of like those hard-hitting public health skills. And then so now these next few slides will be covering what we do during that week number 2 that I was talking about, when all the students go to one of our rural sites and participate in our field work and see our model, how it unfolds. So usually, and it'll be the same this year, the students during this second week will participate in a health assessment and nutrition counseling with our communities. And we call these health stations. So we do anemia checks, we do height and weight checks to get BMI, to just see if children under 2 years of age are on the right track. And if they're not, we give them medication like vitamins. And then we also have a list so that the health promoter follows up with them, so we ensure that it's a sustainable project and sustainable data that we're collecting. And so some of the results we've had from projects like this, we work in this area called Chinandega, and it's very, very dry. Actually, the government of Nicaragua has declared it inhabitable because it's so dry and nobody can grow crops anymore. So we use our data from things like health stations, and also another methodology we use called positive deviance, where we basically do a really in-depth interview, an anthropological interview with some kids who are impoverished but have really good nutritional status. And so from these types of programming, we were able to create a really culturally competent menu and a culturally competent strategy for this community. So this is just an example of some of the materials that we utilize within this community to make sure that all kids can be well nourished, and that we're using resources that the community has. Another thing that students will be doing during that second week of the practicum, during the field visit, they'll be going and making home visits along with our community health workers, along with our health committees, members of our health committee, And also we have a program where people really engage with our water filters, and we'll be going and collecting water samples and testing for E. coli in the water, and we'll also be making sure that everyone is keeping up with their water filters, that they're well maintained, that they're using them to drink, and also using that water to cook with and even wash their plates with. So a really, really important aspect of CBPR, or community-based research, is presenting results back to the community. So students, at the end of their time during the second week of the practicum, they create graphs using the data that we've collected in the community to present back to the health committee. And then the health committee will use that data to have a community assembly where they present the data to their community. They also make an action plan based on the data that they get back. For instance, if we find out that a lot of moms are giving coffee to their infants, the health committee will use that data and figure and create their own kind of curriculum and their own system for getting spreading the knowledge that coffee isn't good for infants, and it kind of or it does contribute to anemia rates. So that's a really, really special time, and it's also really great for the students because it's a great cultural exchange moment. And now Des is going to talk about the capstone and the internships.
All right, so just let me explain that picture that you hopefully see. If you're on the phone, then you probably won't be able to see it, but we'll be sending you the presentation anyways. But it's a picture of a piñata, and the piñata is a mosquito. And we use this for our Zika fair. And we put this picture as just an example of activities that interns do during capstone and during the internships. This was done working with the urban healthcare program, where we're trying to promote education on prevention of mosquito bites, to prevent the spread of Zika in the community of Nahapa, which is the urban community that we work with. And so it requires a lot of creativity, and with the help of a few of the interns, we made this piñata, and we were able to educate the children on avoiding mosquito bites. So just to give you examples of some of the internships that we've done in the past few years, all of the internships are directly related to ongoing programs that we work with. And so as you've heard Jessica talk about the different strategies and how we focus on giving back the data to the community, and then following up, doing a lot of monitoring and evaluation. And it's because we care a lot about women's empowerment. So all of our internships and our capstone projects are going to be things that we actually need to reach bigger long-term goals. And so, for example, for women's empowerment this year, we focused in one community, in the community of La Raz, which is South Atlantic Autonomous Region. It's the hardest community to get to, and it's the farthest one as well. And we were seeing that the rates of home births was very, very high. And the problem with this is if there is a complication during delivery, it will be very difficult to be able to take this woman to the hospital when it's several hours to get to the nearest health center. And so we wanted to understand a little bit better about what reasons were the reasons why women weren't going to their prenatal care, and also to have their babies in the hospital, other than just the distance. And through this very analysis, we were able to analyze that 75% of the women that were interviewed were having home births. And the key behaviors that are preventing women from getting to the health post had to do with money, had to do with their spouse and their family support, and also with transportation. And we also saw a very strong connection between prenatal care visits and the final result, like the final visit to the hospital. So a woman that would go to at least 4 prenatal care visits was most likely to go to the hospital to have their baby. To give you another example of how interns work with us, you have the Youth Empowerment Internship. And the Youth Empowerment Internship has been growing year after year. With our last year, we were able to collect baseline data to understand what the needs of the youth group was in the communities of La Ras. And with this data that we collected from the youth with the help of the interns, we were able to submit a grant, and the grant we submitted was accepted, was approved, and with that funding, we were able to hire a youth empowerment coordinator who will now be working not only in the communities of La Ras, but also in the urban health program. And so we are going to continue developing that program in those communities because now we have the funding for 3 years as well. And because of statistics, kind of like what Jessica was mentioning on the rate of teen pregnancy, we will be having a very strong focus on reducing teen pregnancy rates, working with family planning and topics related to that. So to talk a little bit more about the urban health program, I mentioned at the beginning that we did a Zika fair, but it's all connected with other areas that we work in Nejapa. So the urban health program was the capstone program from last year, and we were able to kind of analyze what were the barriers for people to prevent getting mosquito bites. And we know that the biggest population that's affected through Zika is pregnant women. So promoting family planning was very key. People had very little knowledge then about Zika, and it was very important for interns to go out there with the help of our community health workers from Nejapa to go out into the communities and not only do barrier analysis where we understand the behaviors and the obstacles for certain practices, but also to just provide education, up-to-date education on Zika. And so, like Jessica was saying, we now have a USAID grant that will allow us to continue working with Zika prevention for the next 3 years, and we're gonna be able to cover a pretty big population.
Yeah,
number.
we'll actually be covering in the first 2 years 50,000 people in Managua, and then in our third year where we're really engaging. We have a 3-way partnership with the government, with the Ministry of Health. So it's us as an organization working alongside the Ministry of Health and working alongside the communities. But with the help of the Ministry of Health, we're going to be able to reach a population of 200,000 people by the time we're done with our Zika project.
All right. Well, we could actually keep on talking about how, different ways that interns have supported our programs and, the results that we've had from the research that they've done. We work in different areas like maternal and infant health and like Jess was saying with WASH programs, hygiene, sanitation. You'll be able to get exposure to the majority of our interventions during the practicum and then focus just more specifically on one of the interventions during the capstone and the internships, depending on what you're interested in.
Yeah, and if you decide to do, or if you apply for a practicum and an internship, the capstone and the internship, because the practicum is a standalone thing. If you have 3 weeks, you want to learn about the model, have a week of field work and a week of class, that is a really awesome, very robust program.
Yeah. And so you can find the application information on our website, but just as a reminder, we have early application deadlines by December 31st, and then regular application deadline is February 1st. And if you're interested in applying now, please email volunteer.coordinator@amoshealth.org. Also, an email you can find on the website, and complete your paperwork as soon as possible in order for us to schedule an online interview. And this is definitely for people that are looking into options to fundraise the necessary funds to come during the summer. The earlier you start, the more likely you'll be able to get the funds that you need, especially if you're submitting grants. You'll definitely need to have all your paperwork in and be accepted as early as possible. So the basic requirements before our online interview is to fill out the 2017 online application, which you can find on the website, and also send us your updated resume, the letter of intent, 3 references that can be academic, professional, or from your church pastor, or from a religious spiritual leader that you'd like for them to give you a reference letter. And then also a background check that you can do either through your local police station or also through international ministries that we work with. And I can also provide information on how to reach international ministries to get a general background check. Again, if you are applying to grants, we are very used to volunteers reaching out to us for us to provide more information that will help you fill out the grant forms. And also information you can find on the website is the program costs. And it gives you a breakdown of the project versus the food, lodging, and in-country transportation. Now, food, lodging, and in-country transportation will cover when you're staying in Managua at our Amos guest house, and also when you're staying in the rural communities, food and lodging is covered. If you choose to go out on weekends, then that, of course, is not covered. And then in-country transportation, this means to the rural communities. And we say this because transportation has to be provided by us because of how remote these communities are. So you can see the costs for the 3 weeks of the Global Health Practicum, 6 weeks of Practicum plus Capstone, and then 8 weeks of Practicum plus Internship. And you can also see the project costs. It gives you a general number, and it includes all pre-trip planning and logistics, all printed course materials, all the field work supplies, and all of the coordination, the guest speakers that take several months of preparation with guest house staff, with transportation staff, with visiting the people in the rural communities, defining our projects with both the community and the healthcare teams require a lot of time and effort. And so all of those costs are included in the project costs. So please keep in mind that airfare is not included in this cost. And like I was saying, the majority of our students have received funding in some way, either through church donations or private donors or grants. So you can go to our page called Funding Your Service with Amos, and it will provide you with suggested sources of outside funding. You can contact me and Jessica if you have questions about that. All right, and just a reminder of the times of all of the Practicum, Capstone, and internships. The Practicum will be from July 11th to July 1st. June 11th to July 1st. Practicum and Capstone starts on June 11th and ends on July 22nd. And then Practicum and internship, June 11th to August 5th. So you can see that they all start on June 11th because it is a requirement to take the Practicum if you're interested in taking the Capstone and the internships. All right, so I'm going to give some time for Q&A. Not many people were able to join us tonight. I've heard several people that are traveling to their families because they're off early for Thanksgiving break. So we'll be sending the recording to them, but we'll let the people on the call unmute themselves and ask any questions they might have. Hello?
Hello.
Hi.
Hi.
Since I'm planning to conference with you tomorrow, I'll let the other person ask questions first.
Thank you.
All right. Hi, Rosie. Can you hear us? Oh, okay. No worries. So if you have some urgent questions, feel free to write it in the chat box, and we can answer. If not, then feel free to email us. So let us know what you'd prefer to do.
While she's doing that, I'll go ahead and ask a few questions, if that's all right.
All right. Yeah. Go ahead.
Okay. I should say, Rosie, since I haven't met you, I teach global health at Boulder, and so I was just listening in because I'm interested in the possibility of bringing a group down one summer. But let's see. So a few logistics questions.
Mm-hmm.
First of all, I really appreciate the approach you all are taking. It fits well with things that I've taught about, including positive deviance. So that's really great. So
we had the founder come, Gretchen. Right, I can never say her name right, but she came and taught our whole staff how to do it. So it's really cool. Sorry.
Oh, she did?
Yeah, she came.
She's a mentor and has become a friend of mine. She's very dear to me.
Oh, she's so sweet. Yeah, that's really cool.
Yeah. She actually, I don't know if you know, she actually got married a few weeks ago, which is a big deal.
I heard this. Yeah, that's so funny. Yeah, that's so great.
Well, I'm so glad that you guys were doing that, because when you were starting to talk about nutrition, I thought, I wonder if they dabbled into the positive deviance piece, because it seems to fit well with the, the community-based evaluation you all are doing.
Yeah.
So I'm pleased to hear those kinds of things in terms of content. On the logistics front, so tell me how the logistics work. You fly into Managua, and then are you at Managua the first week and the third week? Is that where the classes happen, or in the middle go out, or are you somewhere else for the classes?
No, so something we didn't have a chance to include in the presentation was a description of our campus, and we're located in the community of Nahapa. Like we were saying, we do urban health projects in that community, and so our offices are located there on the campus.
That's in Managua, or it's
on
nearby,
the outskirts. It's on the outskirts of Managua. It's like 5 minutes, 10 minutes away from Managua. So on that campus, we have 2 guest houses that have a capacity for 100 people. We have a kitchen, a dining area, we have our offices, and we have a clinic. And we also have, this is our newest addition, an auditorium. And so the classes are given on campus in the auditorium, and they're staying at the guest house. The volunteers are staying at the guest house during our weeks in Managua. They're eating their meals also in the kitchen, in the dining area. And when we go out to the rural communities, we use our Amos transportation, which are 4-wheel drive vehicles and trucks. And because it's, as you can imagine, they're very difficult to reach communities, so very bumpy dirt roads that you sometimes wouldn't even call roads, right? And and so it takes several hours to get to these communities. And once we stay there, they're always in close quarters, so it could be the rural clinic, it could be the church, it sometimes is one of the classrooms in the school, depending on like if there's a school during that time, and some families that might have some really big homes or houses. So we're staying in those buildings, and we're sleeping in cots, and they're very basic conditions. We're sleeping in cots. We're taking bucket showers. We take water filters in order to be able to filter the water and drink the water. And we, for the practicum, because it's a pretty large group of people, at times, we have from 15 to 20 going. We take an Amos cook, and we take all of the, ingredients necessary to make the meals to not be a burden on the community. For the internships, it's a little different because they're very small groups of 4 or 5 people that are going out, and so it's not necessary to take a Amos cook. And that's another thing that we prepare students for, is understanding the difference in diet and how complementary snacks are necessary, but also to understand that it's part of the cultural experience to eat the food that the people eat. Yeah.
Sure.
Yeah. So I hope that answered your question. I don't know if you have anything else related to logistics on the field. There's a lot of logistics beforehand as well that we take care of. Like, we help everyone through the application process. We coordinate. We get flight itineraries from everyone to coordinate airport pickup and drop off. We give we'll give orientation the first couple days, a cultural orientation, and also history of Nicaragua before we get into the more international topics. And then we come back again and talk more of the interventions that the community-based primary healthcare, work that we're doing in the community. So, we have a pretty good experience coordinating logistics for volunteers.
Right, sorry, there's background noise here. It's just
No.
That's okay.
I just I'm trying to ask some questions that might be of interest to Rosie. But Rosie, if you think of questions, would you please just enter them in there? Because I'm just kind of asking questions because I think I'm the only other one on the line. Is that right?
Yeah, so Rosie sent us a quick message, and she says that she doesn't have any questions right now, and she can't unmute because she's in a big room. But she wants to listen to your questions because she feels like it would be helpful.
Okay, well, I'm just going to keep firing away, but Rosie, I don't want to hog it, so please write more questions if they come up to you. So how many people can you have at one time for the practicum?
That's a great question. So this year we had one group that was 16, and that they came from the Ohio State University, and then for just the students that sign up to come individually, we had 21, but we can have up to 25.
You can have up to what?
25.
I'm sorry, I still didn't catch the number.
Sorry, I'll type it. 25. There we go.
Oh, okay, but were the 16 and the 25 there at the same time?
No, they weren't. They were at different times. So,
I see. Gotcha.
Yeah.
Okay, that makes sense to me. Thank you.
Yeah. No, thanks.
And then what about security issues? I haven't followed Nicaragua very closely, but do you guys have to be in like a place with security guard and stuff, or what's the safety kind of situation there?
Well, fortunately, Nicaragua is the safest country in Central America. But of course, we still have to take our safety measures, and so we do have guards, and we also have guard dogs, and so we have about 7 security guards on staff that rotate, have different shifts, and then the security dogs are only let out at night, and they're tied during the day. We haven't had any issues. It's pretty safe, but of course it's just a security measure that we'd like to take. Yeah, and so the security guards are introduced to the students at the beginning of the practicum, and they also have Amos shirts on, so that the volunteers know, or get familiarized with the faces and the guards from very early on.
Sounds like you've thought it through well.
Thank you.
So I'm assuming that Rosie would be interested in coming as an individual.
Mm-hmm.
So if I were to come and do a group, would that be at a different time, a different like dates than these dates that you have the practicums generally, or how might that look?
Yeah. So we'd have to see, because right now we have 2 dates, and the first date would be for Ohio State students and possibly also students from another university. So we could have our May practicum with you guys, depending on the number of students. The other option is the June date, and the June date is we usually have 1, max 2 students from each university, from every university that comes down. So depending on the number too, it could also be mixed in with the June practicum. What would be complicated would be having another group while we're working with either of these 2 groups.
Sure.
Yeah.
Sure. Okay. Well, we can talk more about that tomorrow if we want to still do the Skype tomorrow.
Okay,
I'm trying to think
sure.
of any other questions that might also be helpful to Rosie.
I just wanted to say hi to Marianne from Cleveland. She just got on the call. Sorry, Marianne, if there was like a problem with technical issues or time zone error, but we're sort of on ending our info session, and we have some time for Q&A. So feel free to ask any other questions. We know that not everyone was able to join the call today, but we're glad you were able to make it there at the end.
And we recorded this session, so we'll be sending it to you. So you can hear it from start to finish.
Also, if feel free to just chat, just type in your question in the chat box that you can see at the bottom left corner of your screen. Oh no! So Marianne, we can't hear you. It might be something. It might be your mic. Hello? But feel free to type in your question if it's too complicated to fix the mic. All right, guys, so do you have any other questions that you're thinking that Rosie might be interested in?
Let me think a minute here. I'll try to think like a student might.
I guess okay, so I recently got my master's in public health, and so during my practicum, I was in Nicaragua. I wasn't with AMIS, I was with a different organization, and then I was also in Guatemala. And so the projects I did, I was never sure if they actually got put to use, but I can assure you that all the work that the interns and the practicum students and the capstone students do, all of that is put to use. It helps us write grants. It helps us collect baseline data for our programs. We make sure that the projects are something that is needed by the community and is needed by our rural healthcare team. So I just really want to stress that sustainability piece. We update our students about how their project work has been carried forward. We just sent an update probably, I guess, like a couple of weeks ago to the students in their Facebook page so that they would know what was happening with their projects. And then we had a lot of students that just presented at APHA, the American Public Health Association annual conference. So very cool.
All right. Well, Rosie had to leave. She said she had to run, but that it's been very helpful and that she'll email any questions and that she definitely plans on applying. So good news. Very great to hear. Marianne, you still having difficulties there with the mic? It seems like she is. Okay. So she says that she's sorry to come in late, but she's very interested in the practicum and is wondering how many people are accepted and what it costs roughly. Like I was saying to Gay, there's about 25 slots available for the practicum, and for the capstone and internships, there's about 12 slots available. And for the practicum, the training is in English, and the week in the field we work with several translators, and we also give you some vocabulary that will be helpful during your time in the field for the specific projects that we're working with. For the internships and the capstone, a higher level of Spanish is required and preferred, and so an intermediate level of Spanish where you can hold a conversation where you can just have a back and forth where you're interacting beyond just basic Spanish words. And so just for you to keep that in mind when applying to the different programs. And then, all right, so Marianne says she can speak Spanish fairly well. Excellent. Very good to hear. And so regarding the program costs, we have that slide. I'm not sure if you're able to see it, but we'll be sending this PowerPoint to you guys. You can see the breakdown. The cost of food, lodging, and in-country transportation varies depending on how much time you're here. So if you're here for the 3 weeks, you can see how much it is. If you're here for 6 weeks, it's a certain amount, and if you're here for 8 weeks, it's a different amount. And then food, lodging, and in-country transportation, that covers your whole time, whether you're at our AMS campus in Managua or in the rural communities. Of course, if you go out on weekends, that's not included. And in-country transportation to the rural communities is included because they're very remote, and so we take our vehicles. But if you're wanting to go out, to a restaurant or to the mall or to our nearby cities, volcano hiking or something, you are free to do that, but it is not included in the costs. And then project costs include several things such as pre-trip planning and logistics, all the printed course materials, all the field work, supplies, our guest speakers, all of our coordination in the field, and also coordination here in Managua. So like I was saying earlier, it takes a lot of planning to make sure that the internships are sustainable and that it's part of a long-term goal that we want to reach, and not just entertaining volunteers for a short period of time. So because of all the effort put into it, it requires several expenses early on, not just during the summer months. So airfare is not included in the cost. Just to keep that in mind. And then also the majority of our students have received funding in some way. It's usually not out of pocket. It's, it's a combination of maybe some savings, but also through fundraising, through their churches or through individual donors. Also, many have applied to grants. So please see our funding or service with AMIS page to see suggested sources of outside funding. And also you can reach out to us so we can help you with additional information such as, information on the curriculum, on the projects that you could possibly be working on to be able to submit grants. The earlier you do that, the more likely you'll get the grants, and the more likely you'll be able to fundraise through other platforms as well. So if you need help with that, please reach out to us.
I have a logistics question. So with the practicum, does it sound like the whole group goes to the same rural location, or people are divided up into groups, and groups would go to different locations?
So for the practicum,
yes.
Yeah. For the practicum, they go to the same rural community. We all go to the same rural community.
Okay.
But it has to be a very we have to really analyze which community it could be, because it is a very big group of students, right? We work a lot on community development, community organization, and so, but not all of the communities are at the same level of organization, and not all of them have the capacity as well to host 25 to 30 people. So it depends on the projects that they're doing. It depends on their ability to host that number of people, like that big number of people. It depends on how organized they are. It depends on the access, depending on the time of year, on the not only to be able to get in and out of the community, but also their access to water, because we don't want to come in and take their limited resources, right? So a lot of factors that go into play when we are deciding which community would be the most ideal to take practicum students.
Gotcha. And what's the weather like there in June?
It's the rainy season, so it's usually really rainy, really humid, really, really muddy. So all the students, when they come down, we help them buy some rain boots. We'll take them to the market, and they'll buy rain boots to like muck around and walk really long distances, usually when they're checking on people's water filters and getting some water samples. So yeah, it's really hot and really rainy and really humid, but it's very green and very beautiful.
All right. So you don't go for the weather. You go because you
I mean, unless it's a community that you just simply can't get to, and it wouldn't be safe to take volunteers there. But usually, you just got to do what you got to do, so you have to get muddy. If students have a problem with getting muddy, then this might not be the opportunity.
Not the right place for them.
No. Yeah.
Okay. I'm trying to think what else.
Thanks for all your questions.
Yeah,
Great.
they're really good.
Well, I hope they're helpful for other people.
Yeah, I think it is. So Marianne was saying, I was asking if students choose from several practicum project options, or are they assigned, which is a very good question. So for the practicum, we're trying to expose students to several of our interventions. Like, they might not get a chance to see all of them, right, and during the field week of the practicum, but you'll get a pretty good idea of the majority of them. So we'll do like nutrition, we'll do a water filter supervision and lab testing. You're working with community health workers the whole time, and you're also presenting. So you're learning how to work with people that have a low literacy rate, for example. So you're putting a lot of skills to use. For the practicum, you kind of get your hands in like a little bit of everything. Of course, there are certain things that will ask you, like, would you prefer to take the 1 hour walk or the 3 hour walk to go supervise filters, for example? Depending on your capacity, we'll also ask you which station are you most interested in? Would you like to work on the nutrition survey, or are you more interested in how anemia testing and weight and height measurements are being done? Or would you prefer to be analyzing the data from the water samples, or analyzing the data from the health stations to analyze the level of nutrition in the children? So you do have some say in that, but you kind of get an idea of all of those different interventions. Does that make sense?
Yeah.
Yep.
Yeah, but because we only have a short time we pretty much can only offer those specific projects to make sure that they're sustainable. So that's why those projects are off.
Yeah. But for the internships and the capstone, you can apply for the, you can either say I'm willing to be in like any of the internships that I'm accepted in, wherever you see I'm a good fit, or I would actually prefer, to work with nutrition because it's something that I'm very interested in doing in the future, like working with children under 2.
I have a question. The community health workers, are they trained by Ministry of Health? Are they trained by Amos? Or and are they volunteers or are they paid? Kind of what's the structure of the community health workers?
That's a great question. Thanks for asking. So Amos trains the community health workers, but kind of like I said, we do have a 3-way partnership where we work very closely with the government, with the Ministry of Health. And so the community health workers report to the Ministry of Health. And then a lot of times when we're having certain trainings, the Ministry of Health will be there and will also use their training resources, and they'll approve our trainings in the rural communities. And then
nice.
Yeah, so it's really good. And then so our health workers are paid a stipend. It's not a living wage, but they're paid a stipend for their work they do, and they're still they are considered volunteers because they work less than they work different hours, but usually most of them work about 10 hours a week.
Okay.
10 to 15 hours. So, yeah.
And they're considered first responders by our Ministry of Health. So a lot of times they're the ones having of course they communicate to us and they report to us, but they're also reporting directly to MINSA in case of an emergency. If there's a pregnant woman that needs to be taken out of the community, they have the contact numbers of the director of the nearest health center and the ambulance and all that. So they're, it's part of their training and their organization training, and it's really neat to actually hear the stories and the testimonies.
Yeah, I'm sure. And so what would be the population of some of these rural communities that people might go to on that week number 2?
Well, it varies. We probably wouldn't go to one of our smaller communities that have about 300 people. We'd probably go to those that have 600, 700 members.
Yeah. I'll let Marianne write some more questions if she has some more, so I don't take up all the bandwidth there.
All right, Marianne, do you have any other questions? So sorry the mic still isn't working, but you can feel free to type in another question if you have. All right. Well, she might be typing, but maybe she doesn't have any other questions right now. Marianne, let us know if you have any other questions. Also, feel free to email us to volunteer.coordinator@amoshealth.org, which you can also find on the website. Gay, do you have any other urgent questions before our Skype call tomorrow? If not...
No,
Okay.
Yeah, no, that's good.
All right, excellent. Thank you once again for all of your questions. Oh, okay, there's one more question. So Marianne is saying she has a clinical background, so I'm wondering if I'll be able to integrate that. So it depends on what you're interested in. So it depends. For example, if you'll be able to see how the community health workers work in the rural clinics, but it's not the same as shadowing, for example, a physician in our urban clinic. That is more something that we'll do during a 1-month rotation. That sometimes we have med students, residents, or pre-med students, or nursing students that come down and work with us for a month, and they're depending on their level of clinical experience and studies, they'll be doing different things in the clinic that are more clinical, you know, like seeing patients and doing consultations.
But yeah, we are primarily focused on preventative healthcare. So that's really the focus of our practicum, less clinical, more public health, more preventative medicine.
Yeah. I would say that your clinical background combined with with our community-based primary healthcare model goes really well. And I've seen that people that have that combination of both do really well, you know, in the field of rural public health, you know, community-based health. But for this experience, the most clinical would be taking anemia samples and doing height and weight. And then, you know, playing with the data and analyzing the data and giving back the information to the communities. Would you be able to explain what kind of experience you were thinking of? Sure, medicine resident.
Oh, very cool. That's awesome, Miriam. That's really cool. Yeah, cool.
Yeah, I think it's preventive medicine. That's really interesting. That is definitely what we focus on. Yeah, community-based primary care model. Yeah, it's for preventive medicine. That's definitely a good model to learn and to apply wherever it is you work. You know. Yeah, but thank you for asking about the options. But we do want to be clear with like the applicants that it's not a purely clinical experience. It's mostly community-based health. It's preventive education, and it's research on how to improve certain behaviors in the communities in order to improve your health as the final result. Yeah. All right. Okay.
Yeah, so thank you guys so much for joining us this evening. And we really appreciate it. We would love to keep chatting with you guys all night, but unfortunately, I have a bedtime. I love to sleep a lot. So anyway, please, yeah, be in touch. Send us any questions you have through email. If you want to set up another Skype meeting for more details, we'd be happy to do that as well. Yay, we look forward to talking with you some more tomorrow. Yeah, but
Yep.
also, Marianne, we just wanted to share that our early application deadline will be on December 31st, and then our regular applicant pool, that regular application deadline is February 1st. And we'll be sending you this recording too, so you can get more information. But once again, thank you guys so much. We hope you have a great evening.
Yeah, and just like so Marianne was saying that she's interested in the practicum for an MPH requirement, and that is, you know, we have a lot of MPH students that are that apply and that come down because of that, and it's usually a really great fit with their school requirements. So if you have any questions about that, to see if it's a good fit, feel free to email us about that as well. So thank you again. Like Jess was saying, it was great to hear your questions and to be able to share more about the program and what we're planning for next year. So we'll be in touch and sending you this recording, and I'll talk to you tomorrow.